Hi, this is Linda Rudd from Optima Living Therapy. Again, we're extending our information videos to address problems with the knee since it's such a common occurrence in Arizona around this time of the year. So one of the things I'm going to share with you today is a self-myofascial technique. I can speak from personal experience watching my husband spend a couple of years chasing chronic knee pain, visiting a number of orthopedic surgeons, having cortisone injections, even paying out of pocket for PRP, and in the end, what solved his problem was soft tissue body work. It turned out that he had a lot of tendon and muscle tightness, and by doing the myofascial work and then extending that by doing some of his own self body work, he's been able to maintain being pain-free with his knees. So I'm going to show you today a quick exercise. This is our Soma system. This is our foam roller. And I'm just going to put it directly under my knee. So we focused a lot on the anterior of the knee, but right now I'm going to show you a couple of things on the posterior of the knee. So I'm going to put a little bit of pressure. I'm going to focus on trying to release the tendon from the lateral and medial heads of the hamstring, which are going to cross the back of the knee and attach up here at the top. And so literally I'm just going to put pressure here, lean into it for the outside, and just slowly roll. And you'll feel where the tendon is tender, and you can rest and put just a little bit of pressure on there. So I am kind of elevating myself so that I can get the right amount of pressure here. So I'm elevating my bottom off the ground, leaning on my hips. You don't necessarily have to. You certainly can do a little bit of less, just get it right in that targeted spot and sit down and roll. But I find I get a little bit more pressure and I'm able to get it right on the angle where I need to, and you'll know exactly where that tendon is tight and where it needs a little bit of release. So you can roll back and forth slowly, probably 3 to 5 times. And then I'm going to work on the medial side by just turning inward a little bit, and same thing, just below the knee, not all the way down to the calf muscle, and really just focusing on those tendons of the hamstrings that cross. I'm going to do that 3 to 5 times. And rest. And then of course I always like to, I do a lot of hiking, and so I do like to work out my calf muscles as well. And so the same thing over the gastrocs, just rocking back and forth. And I'm looking for those tight points where those tendons are, and I can hold that position there, or I can make my roll a little bit more shallow so I can really target where I'm getting some of the knots and the tensions in those muscles. So that's it. Don't forget, if you've had any type of surgery in the last 3 to 6 months, please see us first. Also, when you're doing self-myofascial work, it can cause a little bit of inflammation. Drink water afterwards. If you're hitting any trigger points, you're releasing toxins into your system, so drink a lot of water. And don't forget to ice, especially in the evening when our bodies can go through inflammation. So definitely put a cold ice pack. Protect your skin. Don't put it directly on your skin. Always have a towel or a light linen cloth to protect your skin, and put ice on it for 10 minutes, and that should help to alleviate a lot of the tension that you're feeling in your knee. So give us a call if you have any questions, and feel free to comment below, and we hope you find this helpful.